viewers will know that Venetoclax in myeloma has been a bit of a torrid story. There have in fact been now 2 negative randomized controlled trials. First, the Bellini trial, which looked at all patients with myeloma, not just those with translocation 11-14, and then the most recently presented Canova study, which looked just at patients with translocation 11-14. And unfortunately, both of those trials were negative, and there was in fact an overall survival decrement in the Bellini study thought to be due to infectious toxicity events. However, there clearly is clinical activity, and so there's still a lot of work underway in the myeloma community to try and work out the best use of agents like Venetoclax and the newer sonrotoclax, which remains in clinical trials. And so we conducted a real-world study using the Flatiron Health database, which is collected through electronic health records of about 208 patients with multiple myeloma receiving Venetoclax. And what we found was that about 70%, just over 70% of those had translocation 11-14, and that over time that increased, that in more recent years, mostly people are using Venetoclax in T11-14. We also found that the outcomes, the progression, the time to next treatment and overall survival in patients who were receiving Venetoclax were better in those with T11-14, which supports the kind of biological hypothesis, biological rationale for that use. And we found that Venetoclax, when it was used in combinations, had more durable time to next treatment. And so, although it was used a fair bit as a single agent or just with dexamethasone, in fact, when it was used in combination with other agents, it had a more promising activity. And so I think this supports the ongoing study of Venetoclax in T11-14 myeloma. It's just going to be about finding the right group of patients, the right combination of treatment, the right dosing, and the right disease context. So I think reassuring, but still definitely more clinical trial data needed to ensure that this is a safe treatment as well as an effective one.